cause and the reason that's today.
Hi there. We're just about to get going, so we'll ask you guys to mute your phones, and then once we're finished, we will open up the lines for questions.
Great,
Thank you.
Okay, welcome. Thank you everyone for coming today. I would like to introduce our Medical Officer of Health for the Simcoe Muskoka District Health Unit, Dr. Charles Gardner.
Good afternoon. It saddens me to report that we've had a COVID-19 associated death in Simcoe Muskoka, as previously reported by the Chief Medical Officer of Health earlier today. This is an individual, a man in his 70s, from Barrie, being treated at the Royal Victoria Regional Health Centre, and presently being investigated by the provincial coroner to determine the relationship between his COVID infection and his demise. He did test positive on post-mortem samples, which came back very late yesterday. And at this time, I think it's important for people to be aware that this is our fourth case that we've had in Simcoe Muskoka, and that it's a reminder of the importance of this disease and the importance of people taking measures to protect themselves and their loved ones. We had previously reported Sunday afternoon of another individual who is still receiving treatment at Royal Victoria Hospital who tested positive for the COVID virus, and had also noted that there was a close contact between that individual and an individual who had deceased, and so I'm making the connection for you now between that announcement and this announcement. At this point, in addition to encouraging people to take all the precautions that we've advised all along, I'd like to speak in support of the measures that the province has put in place to flatten the curve, to reduce transmission of COVID in our communities, all of them aimed at reducing interaction between people, promoting social distancing so that the spread of this virus is impeded and slowed, and so we can protect those who are most vulnerable from this infection. So I would certainly encourage people to be supportive of those measures, and in particular for those who are vulnerable, those who are older than 60, older than 65, those who have pre-existing medical conditions, to be mindful of that and take additional precautions in reducing your exposure to the likelihood of getting this. I would certainly like to express my condolences to the family members of the deceased individual. My heart goes out to you. Be happy to take questions with regards to this situation.
When you say contact, was there a relationship between these two gentlemen, or was the contact made at RVH? Just where by correlation?
These individuals had contact out of the hospital, actually, much more so than in the hospital.
Is there a relation there? The man you said before, I think, was visiting from Alberta, is that correct?
The other individual, the patient that I reported to you on Sunday, did travel from Alberta, not at a period of time in which he would have been infectious or communicable.
Were you able to trace where that point of contact was made with this other person who passed away?
As yet, we have not been able to identify the ultimate source of infection beyond these two individuals. We continue our investigation.
How soon after they had close contact did the individual who died pass away?
They spent time together in enclosed spaces over several days, multiple times.
Were they traveling together?
I beg your pardon?
Were they traveling together?
Not out of this community.
And just to clarify, you're saying that the deceased had the virus, but it's not entirely clear that was what caused their death.
The deceased was in his 70s, had other pre-existing medical conditions that would put him at risk, and so the relationship between his infection and his death is under investigation by the Chief Coroner's Office.
Dr. Gardner, are you confirming that the deceased patient was from Barrie?
Yes.
Okay.
Dr. Garner, are these two individuals related to each other?
For the protection of privacy, we usually withhold that kind of information.
Why was the individual who passed away admitted to the hospital in the first place?
The individual was admitted because of complex medical background in general. I wouldn't divulge any further information for the protection of privacy.
Was there any, the determination was made that they had COVID-19, was it post-mortem or was it before they had died?
There was suspicion at a point after they had died, leading us to seek post-mortem testing to investigate that possibility.
So how important is that going to be going forward if people are, they say this was an older individual, is this going to have to become a routine thing where any death going forward, if there's even, does this need to become routine when we're testing for COVID-19?
That's a very important question. It really speaks to our ability to identify potential cases. And certainly I think that this is an important situation for us to learn from and might serve to heighten our index of suspicion about potential cases, and therefore to be that much more vigilant for protection of hospital environments, of people working in hospital environments, and investigation of potential cases.
Dr. Gardner, this morning there was a bit of confusion as to where the patient was from, with the province reporting Muskoka region. In the future, will there be dialogue between your health unit and the government to clear up things like that and not cause panic in different regions?
I can assure you that we had close dialogue with the personnel within the Ministry of Health very early on with regards to this situation, once we had the information that was pertinent.
Okay, but with the minister saying it was in Muskoka, will you differentiate between the two regions in future cases if you have to report deaths?
I cannot. I can assure you that we were very clear in our communications internally with the ministry, with personnel, and certainly we are committed to being clear in our communications to the public about what's essential to know.
Dr. Garner, you mentioned that the individual who passed away actually had close contact with the person who was admitted to, who tested positive. So as soon as you found out that they had close contact, so nobody decided to run a test on this 77-year-old man immediately?
The index of suspicion about the potential for the person who died, this individual that we're speaking about today, in part was related to the identification of the other case. And as soon as that was suspected, all action necessary to investigate properly was taken.
So was this person who died admitted to the hospital before or after it was discovered that they came in close contact with the other person who had COVID-19?
The individual who passed away was admitted to hospital, passed away, and then later identified as possibly a case and investigated post-mortemly. And at that point, we were notified as a health unit, and we conducted our investigation in order to determine all contacts that could explain his infection related to the other case, and contacts that would potentially put others at risk, and individuals that were affected by this have been followed up and put into home isolation as required, or are doing self-monitoring. You would also note from the press release on Sunday that we did identify one public location, that we put out public notice at individuals who had been at the Hampton Inn from the 5th to the 11th should also be monitoring themselves for a 14-day period for signs and symptoms of COVID, and should be isolating themselves and seeking assessment if they develop symptoms.
Was there an indication that the man who died had also visited the Hampton Inn?
So we give information as necessary to protect the public without divulging information that might violate privacy. So the fact that that particular location has been identified and we've publicly communicated about it is for the purposes of protecting people, and we otherwise wouldn't provide further information that might compromise privacy in this situation.
Dr. Gardner, how long do you think the coroner will take to determine the exact cause of death?
Excuse me, it's Kathy Dermott, the media coordinator. I'm just going to try and coordinate these calls a little bit better. So we're going to take some calls within the room here, and then we will return to the line. So CBC?
Can you tell me, how satisfied are you with the extent of testing that's taking place now and the availability of testing units, or however it's done? Mm-hmm. Are you satisfied with how satisfied are you with the extent of testing that's being done today?
Certainly, all efforts are being made to make it as available as possible, but I do not believe we are meeting the demand. It's quite clear that there's a much greater desire for testing than is what is actually being able to be achieved, in part because of shortages of swabs and limitations of personal protective equipment, and a heightened anxiety by the public leading to a surge in the desire to be tested. And I think it's highly desirable that we meet demand as much as we can, because that helps people to know whether or not they are infected and helps them to comply with the protective measures to prevent it from being spread to other people.
Can you also tell me what it means for you as a healthcare provider, the fact that this was discovered post-mortem? How much harder does that make your job, not being able to speak to the patient? You can't ask the patient any questions because you didn't realize that they were infected until they had died. Mm-hmm. How does that impact your ability to fight?
Clearly, it is highly undesirable and makes it more difficult for us to do our jobs. There are other individuals in this person's life that we are able to get histories from in order to piece together a picture of where this person had been. I think from that we've been able to do that sufficiently well to protect the public.
Would it be classified as a community transmission, or is it still because of travel?
I don't think we can call this a travel-related case. There wasn't international travel involved. This individual did not travel. His close contact had traveled from Alberta, but that hasn't been identified as one of the locations of concern up until now. So I don't think we can classify it as such, nor have we otherwise identified a clear line of infection back to a source. Although we are continuing to investigate at this point, it does beg the question, is this community acquired? Is this evidence of some transmission in our community? I think that heightens the importance for people, the awareness that that's possible. It's possible. We're seeing now some community transmission happening, and that people need to take their precautions.
Do we know any numbers from yesterday's opening of the assessment center, or how many people were sent to the RVH, or any numbers at all? Is it too early for that?
I'm just looking to Janice Scott. If you are, I mean, I've heard some numbers, but I don't know if you would be happy to speak to this question or not. Okay. Thank you.
Good afternoon. Yesterday we opened the assessment center at 2 o'clock and it's to remain open until 8. And similarly, we had to actually stop taking names after 6 o'clock because there were over close to 100 people just yesterday. Today we opened at 8, and already this afternoon we've had hundreds of people coming to the assessment center in Huronia Drive. And back to us, which was your question. About 7 were requested to come back to the emergency department because that's where the swabbing will take place, the testing. So there's, as Dr. Gardner said, it's obviously heightened anxiety. Many people coming to the assessment center. We ask for people to get on the RVH website and look at a self-assessment. Please only come to the assessment center if, in fact, you have symptoms of COVID-19 and they're not minor that you can manage at home. You need to see a health professional, and then there will be a series of questions asked of you, and then if it's necessary for you to have a test, you'll then be directed back to the RVH with a piece of information that informs the emerge that you've been through that process and that you will then be tested. But there are a lot of people there today, and so clearly between supply and human resources, we're going to have difficulty meeting this demand if the week continues this way.
How hard and difficult has it been for you to track backwards the disease, Joe, and to gather staff and say, where were you? How does it work in the hospital in a situation like that?
So tracking the patient with COVID-19 is the district health unit's responsibility under Dr. Gardner. Our responsibility is to make sure, one, that we're cooperating, we have an excellent working relationship, but two, of course, our interest in our employees and our physicians and our volunteers. So I can assure you that when the patient presented to the hospital in the emergency department, given that the symptoms that he was expressing, that the patient was cared for appropriately, brought directly to a room on his own, also that our staff and physicians had the proper protective equipment on. The patient was with us for less than 20 hours, to put some of this in perspective. However, the patient does have a long history with us as an ambulatory patient, and so for any staff who have been involved with that patient directly, we've asked them to stay home and self-isolate. If others were in the general vicinity, as well as perhaps already wearing appropriate protective equipment, they've been asked to self-monitor. And we have a full list of all of the staff, physicians, and if volunteers were still in the building at the time. And I believe we've communicated with all of them, and they have the appropriate instructions to either self-isolate or to self-monitor.
Has anyone been tested for COVID-19 of that staff?
Based on the following the symptoms and the isolation to date, no one has been tested.
Is there anything you can say, if either one of you want to take this one, is there anything you would like to see from the local level, government levels, provincial, federal, that you're not getting right now that you think needs to happen now, or something that can help you do your job?
Well, the movement to open up assessment centers is critically important, and we started a month ago identifying potential assessment centers throughout Simcoe Muskoka. I'm happy that we were able to open the one here, and we'll be shortly moving to open up one in Collingwood. We have others in mind throughout Simcoe Muskoka. That's critical. That has to continue. We have to continue to increase capacity for people to be assessed. I do know that there are local physicians looking at doing virtual assessment as a means of giving better access for people to be assessed. I think it's really important what the government has done to put in place the public health measures that we've seen just this week, the closure of schools, the discontinuation of all events of more than 50 people, the closure of restaurants and bars, closure of daycare, the encouragement for people to do social distancing of 2 meters, the promotion of hand washing. All of that is really critical at this time because I think we're in the flex point of changing from imported cases to local transmission, and this is the point we need to get ahead of it and prevent that or dampen that from happening. We do expect that kind of transmission to happen. We do expect a substantial increased number of cases, but the real goal here is to put in place those measures that will dampen it down to the point that we can still manage with our healthcare system to provide the care that the people who are most ill with this will need. I think we need to keep driving home the message for the public to abide by these things and to take it to heart themselves and to exercise the social distancing. And I think we may very well see in the days and weeks to come more measures put in place. There are more things that government can do related to requiring workplaces to be operating from a distance and out of the home rather than merely encouraging it, and putting perhaps further restrictions in place about people's movements. Those are things that may come to pass. We'll have to see if they're necessary. All of that would be directed towards flattening the curve, as they say, to control this outbreak, this pandemic in our communities.
I'm wondering about, I guess maybe through our age of the 3
Yeah.
cases. Has there been a ban now on all visitors outside of compassionate grounds?
Thanks, Ian. As of today, we are now banning visitors to Royal Victoria Regional Health Centre, with the exception of one visitor with the individual presenting our emergency department, or one visitor with a child, and certainly one partner in our obstetrical or postpartum area. And of course, there are always those compassionate grounds, and those will be dealt with at an individual level. We've also closed down our food court at the hospital as of 2 o'clock today as well, and removed a lot of the chairs in the facility so that we're forcing the social distancing, which is so important. If I could just add with respect to the public, it's that concept of being prepared but not scared. So if people, we know this is very anxiety provoking, but the lineups are going to just make people very frustrated. Even I was there yesterday and people weren't understanding, we're not testing. You're not going to find the swabs here. So really informing yourself, making sure you're monitoring for your own symptoms, coming to either the assessment center or the emergency department if it's necessary. If your symptoms are mild, we really encourage you to stay home and take good care of yourself, isolate yourself from others, and those are the most important measures that can be taken, and that's really asking of people.
How prepared do you think you are? I mean, if the worst happens, you see an outbreak here on a scale of what we've seen anything?
At RVH, we are a 24/7, 365 facility, and for many infectious diseases, we are meant to be prepared every day. Clearly, this is not business as usual, and it's on an entirely different scale than many of us have seen in our career. That being said, the team at RVH, along with all of our partners, have been preparing for now months with respect to this, and our limiting factor will be 1, supplies, 2, the number of beds, and 3, just ensuring that we are able to keep our own personnel, physicians, and our staff healthy so they can continue to provide care for the patients who are in need of our care. And in terms of preparedness, we know what to do, and now it's really going to be a matter, as Dr. Gardner said, just flattening that curve, really managing the increase which is anticipated so that we can respond. For example, we have been given approval to safely move a number of our alternate level of care patients out of our facility, and we're making arrangements for those patients to move safely to the IOF in Barrie over the next week. That's going to immediately free up about 26 much-needed beds. We're all working with the province with respect to ventilators, respirators, but the overall supply, being able to fulfill that is so important. Again, getting back to the public, we don't want to waste masks or swabs if in fact it's just a curiosity or very, very mild symptoms. We need to work together to make sure the supplies are available when we all need them.
If I were to, I'm just also going to follow up from, I think it's an excellent question, and I think it could be applied broadly, like how prepared are we all? So as a health unit, we've kept up our emergency preparedness plans for years. We just updated it last fall. We've actually deployed most of our staff now to this response. It's been very demanding already. I think it will be a great challenge for us if it fully surges. I think it will be a great challenge for all of us if it fully surges. We've promoted publicly that members of the community should have sufficient supplies to be in a quarantine or isolation for 14 days. There has been a lot of buying that probably is excessive on that. I would encourage people to be moderate now in that so that there's enough to go around. We've encouraged businesses to have business continuity plans in place so that they can work remotely, have their employees work remotely. Now put that in place so that they don't have to travel in the community or gather in the work environment and therefore reduce their own vulnerability. We've held district-wide video conference on Monday, tapping into the healthcare facilities, EMS, municipalities, and other public service agencies about their response, how they're doing, and have gotten a pretty good sense about the various issues they have and the challenges they have, but also the measures they're putting in place. So I think our community is ramping up well on this. Our municipalities have, in fact, shut down the public events that we would want them to do, and they did so before the declaration of the emergency. As I said, it's really important that this be done in a timely way. I think it's really important for those returning to Canada at this time to heed the plea that they would put themselves in quarantine unless they are a healthcare worker or an essential worker, and to monitor themselves otherwise because of the potential to continue to import this virus to our community, considering how it's unfolding in other countries, including the United States. I think we're as prepared as we can be, but the real key here is to flatten the curve now.
How unrealistic would a lockdown be, like we're seeing in Italy?
I would want us to strive to avoid that, to be effective now so that we don't come to that. We have seen some countries that have done better than others on this. So Italy, most tragically, has had like a severe manifestation of what we're talking about, and have now got themselves into a full lockdown situation. There have been other countries such as South Korea that on a per capita basis did considerably better in terms of case fatality rate, identification of cases, availability of testing, and they're very much on the downward side of the curve. China, for that matter, is very much on the downward side of the curve. So there is hope that if we do this and do this aggressively, well, and timely, that we can be that we can do much better with it, with flattening that curve.
How slow was the province and the Canadian government in reacting to this? Could it have been way better?
They've acted while the cases are still reasonably low. They've certainly acted quickly in this week, and I would hope that they continue to monitor and do even more if they have to. And I think time will tell whether or not it was timely enough. At this point, it still seems that the great majority of what we're seeing is imported, but then there's always the lag between what you see versus the testing that will come, the cases that are incubating now that you don't know about at this time. Time will tell.
It must be alarming to see that community transmission is possible in Little Old Barrie.
We expected that it would come. We didn't know exactly when, so we're not surprised. It is important for us to know, it's important for the public to know. I say that people need to be aware and informed, but that is more helpful than being alarmed, and that they need to take measured steps in accordance with what we're advising.
Shane, do you have a call?
No, I don't.
Okay. Do we have some more questions from the line?
Yes. Sorry?
No, go ahead. Go ahead.
Okay. Dr. Gardner, how long will the coroner take to determine whether or not the virus caused the death?
It's my understanding, they're expediting it now, and it's my understanding that we probably will have the answer to that tomorrow, though I cannot guarantee it.
Okay, thanks.
There have been obviously 3 other cases confirmed since Thursday. Can we get an update on how some of those other people are doing?
So one individual, the other male in his 70s who was admitted to RVH remains in our RVH. The other 2 individuals had been assessed and sent home for isolation and are recovering.
Okay. The man who you reported on Sunday, it made it seem at first like there was like the initial point of contact between that man and the man who died was at RVH. Obviously, that's not the case.
No.
But the man who is still being treated at RVH seems to have wandered throughout the hospital. By the sounds of it, do we know where he entered from and how it was that he was able to be around for so long before he was recognized and tested?
So I think that question would be best answered by Janice Scott.
Sure.
Thank you. I believe as we reported on Sunday, the patient who is COVID-19 and currently in our facility entered the hospital through the emergency department. He had some tests done and he was transferred to a inpatient unit. He did not wander throughout the facility.
Okay. How was he able to have contact then with other patients?
He didn't have, this is not what Dr. Gardner is considering the point of transmission at all. I think it's been identified today that these two individuals knew each other outside of RVH.
But what about people within the hospital in the emergency department? Like, had anyone come into contact with him?
So we worked certainly over the weekend to ensure we had a full line of all the individuals who were in contact with the patient who we identified on Sunday. And as I mentioned, for those who were in direct contact with the patient, they are on self-isolation at home. For those who were in the vicinity or who were using the appropriate protective equipment, they have been identified and are self-monitoring. At this point, there have been no one has presented symptoms to us, as the question was asked earlier, and therefore there has not been any further testing of the employees, including the physicians.
Are they self-isolating?
Those who have been in
physicians?
Yes, those who are in direct contact with the patient are self-isolating, or if they were in the vicinity or wearing the appropriate protective equipment, they were screened at the organization and they are self-monitoring.
Do you have any idea how many people he came into direct contact with at the hospital?
Do you mean staff and physicians?
Yeah.
Of the patient that we identified on Sunday, we were in contact with just over 30 people. And that would be a breakdown of those who are self-isolating and those who are self-monitoring.
What does that do to your ability to get 30 people? Well, not on commission, I guess. How many are actually self-isolating?
I don't have the exact number today, but I can assure you that we've been able to fill all the staff schedules, and at this point in time, we have sufficient medical staff to continue running the hospital. But yesterday we did announce that we have canceled all elective surgeries and today all elective outpatient procedures that would not negatively impact our patients from a clinical perspective. So we're able to redeploy those staff to ensure that we're continue with the services that are essential, such as our emergency department. Essential surgeries are going forward. All cancer treatments are going forward, for example. So we have a deployment. We have a redeployment schedule that we're continuing to refine, obviously, but we do believe the resources will be available because part of the hospital is now not functioning.
Dr. Gardner, are you satisfied that the Hampton Inn is safe for guests to stay at?
Absolutely, it is safe now, and the issue was the dates in question in which the patient that we referred to on Sunday had been staying at the Hampton Inn, and so we wanted the public and those who had been there aware of that and self-monitoring, and then seeking isolation and assessment if they developed symptoms.
How worrisome is compliance with self-monitoring, self-isolation, especially those who have come from the United States who say, look, I'm good, I'm impenetrable? How worrisome?
We rely on people, the broader public, to a large degree to comply, to exercise their good citizenship at this time. And I cannot guarantee that all do this. We can only implore that they do so. For those that we have on a list, because they're in contact, we follow up and do our best to ensure that they're complying. But generally speaking, we're finding that we don't have evidence that people among those are not in compliance.
So I think we're probably very close to wrapping up. Does anybody from the line have any further questions? Okay, thank you. Any further questions from the floor? Okay, thank you. We have a newcomer. Do you need some footage from Dr. Gardner?
Wouldn't mind, and basically whatever comments you had off the top, would you mind giving those for me again? Sorry, we've been spread out all over the place. You know, I was an hour late when I got the call. Would that be okay with you? Sure. Sorry, just the Coles notes at the beginning of your prepared comments.
Okay. It greatly saddens me to report that here in Simcoe, Muskoka, we have had our first death from COVID-19. This is a man in his 70s